Namaskar. In last 6 months' time, I have come across a few patients who were pretty old and they were in the intensive care units for very long times. Some procedures were conducted in few people, and ultimately end result was that they had a lot of suffering, and the family members also, they spent quite a lot of time and money, but ultimately with poor outcome. I mean to say, getting the body back home. My only contention is that particularly after certain age or with comorbidities, a lot of comorbidities, we know that the outcome is going to be poor. So in those cases, from both sides, from the doctor as well as from the patient, both sides, there should be a mutual discussion regarding the ultimate outcome and the results that is expected from the procedure that is being conducted. I mean to say that ultimately the family members have to take the decision, and sometimes you find that most of the doctors who are older, when I interact with them, they tell them that I just wish that I am not in the ICU at the end. That is the kind of mindset my seniors have. I have discussed with many regarding that. It is because it just prolongs the suffering and ultimately without any end result. And lying down on a bed without meeting your own relatives and your own kith and kin, your own friends, staying segregated and ultimately leaving this earth and dying without being your own people on the bedside is something which is very, very painful. Some friends suggested me that can we have some kind of a will where we tell that, okay, at this, if I have this condition, then do not take me to the ICU and I am just made to get treated at home or in some normal routine room in the hospital with nursing care. So that is the degree of scare that is there in the doctor fraternity itself. This makes me make this discussion. I just have an advice to the patients. When your parents or your elderly relatives, they are getting admitted to the hospital, please think about the age and the condition of the patient, because ultimately the end has to come someday and it's beyond our control, and we do it in the best possible way, reduce the pain and give them the comfort. With the comfort, give them a nice passage to their ultimate destination. So again, I request everyone that particularly people says is above 80s, 90s, like that. When they are to reach the ICU, it is better them to provide all the facilities, and I advise all family members to be on the bedside. It will be a very happy moment for the patient to have a look at the known faces around him rather having unknown faces around him at the time of demise. Thank you so much. Namaskar.